and it's great to be here. There's a bit less of me than there was last year, but we're learning to cope with that. And it's fantastic to see so many people here. And the one thing that we share in common is that we're all passionate advocates for oral health. And it really is important. And we thank you as always for your support in very many different ways. Can you believe it's the 49th year of National Smile Month? I think we are actually the longest running campaign of this sort anywhere worldwide, so it's a fantastic achievement. So we're running up towards 50, thinking about how we do big celebrations next year. Some of you will have heard this before, but it's sad to say that I was actually present at the first National Smile Week, as it was in Birmingham all that time ago. It does really mean that I should retire, and I will be doing that shortly, so you may only have to put up with me for another couple of years. Now, they give me a speech, as they always do, but again, those of you who know me will know that I very rarely stick to the speech, and I'll probably forget things in it or add things to it. But as I say, you know, it is incredible. We're going back to 1977, and oral health was in a very different place then. The British Dental Health Foundation, as it then was formed on the back of the 1968 Adult Dental Health Survey. And the fact that I always use that comes out of that is the fact that 33% of the population, adult population, had no teeth at all. And you have to think about that twice. It's 38%. You have to think about that twice, because that was people over 16. So the expectation in the UK at that time was that by the time you got to middle age, which then was not as old as it is now, it was probably 40s to 50s, you were going to have lost all your teeth. We've come a long way since then. I'd love to say it's because of the Foundation's activities over that time, but it actually has a lot to do with some of our sponsors for the campaign putting fluoride into toothpaste in that period, and that made a lot of difference on the decay front. So really, what's National Smile Month all about? It's about getting people to come together. It's working across the profession with our trade sponsors to actually really promote oral health to the community and patients and the public at large. And that's done in very many different ways. We're going to hear later about some community activity, but also we have dental practices who will have open days, they'll open their doors, they'll have events in their practice, bringing patients and the public in that maybe wouldn't attend and giving a different aspect. And let's face it, those of us who are dentists here will all know that you end up locked in a little cell with your dental nurse and the patient who can't speak because you've got things in their mouth. So it's quite a lonely environment, and actually being able to break those four walls, get out and communicate with people is a great thing. We're meeting here today in a building that's steeped in history and reflecting that. I mean, we're in the RICS building, so Chartered Surveyors. We've been surveying oral health in a different way with the Oral Health Survey about to report again. It will be very interesting to see what the results of that come out. But this is a very fitting venue to be shaping the future of health, oral health and well-being. And you'll notice the way that I put it there, that it's health first, oral health second, because you can't have one without the other. And increasingly, that is going to be the motivator for people going forward, that you can't have good general health without oral health. Now, I'm not going to go through a lot of what David just very carefully written for me. Results of our survey for this year. You're going to have to watch the press releases and the social media to get some of those facts. But we've got lots of interesting information around how often people miss brushing their teeth, how often they don't brush their teeth at all, how often they don't brush them twice a day, and various things from that point of view. But our thrust and aim of the campaign this year is around one of the other risk factors. We're talking about Feed Your Smile, as you will have seen behind me for the campaign. So it's great to be launching this campaign today, and it's exploring that powerful link between nutrition and oral health. And we've seen this highlighted in the last week, 10 days, with the Panorama programme on baby feeding and pouches, really a huge problem for the future. Baby food has always been unhealthy, much of it based on apple puree because it's cheap. That makes it sweet, it makes it unhealthy, it encourages the baby and the young infant into a liking for sweet things, and it really is something that we're going to battle. And there's great campaigns going on there, some from the British Dental Association, some being led by the Children's Food Campaign and Sustain. Do go onto their websites, sign up to the campaigns there. We really need to do something about this as a problem, and encourage people to go back to healthy nutrition and feeding for the baby. I am told, I can't remember when I was a baby, but I'm told that if they tried to feed me with something out of what was then a jar, not a pouch, I would spit it out. So my mother in those days had to actually make things from scratch, and that's really the way that we should be encouraging parents to go, not giving apple puree based products to their kids and encouraging decay at an early age. And it's still distressing. One of the most distressing facts that we highlight every year is the number of children admitted to hospital for anaesthetics for tooth extraction. It's the largest reason for children to be admitted to hospital for an anaesthetic in the under-12s. And that really is quite horrendous because it's a preventable disease. It's totally unnecessary that we get those hospital admissions. And part of that is around this whole child nutrition that we're looking at there. Encourage you at the moment also to look at the consultation that the government are doing on expansion of the sugar tax. When sugar tax first came in, I don't remember how many years ago now, but probably 8 to 10 years ago, it missed out things like flavoured milks, yogurts with added sugar, etc. And there is now a consultation there which you can contribute to, talking about expanding the sugar tax to those areas. Very important. We'd also like to see some of that money come back into oral health rather than being siphoned off into the Treasury elsewhere. It might be a vain hope, but we can keep asking for it. The concentration with the sugar tax coming in was all around diabetes and around obesity, and oral health got very little mention. Whereas, of course, the immediate impact is going to be around oral health in terms of reducing that sugar intake. So, we've got some interesting information coming out from the research. I've mentioned brushing opportunities. We've also discovered that diet is not top of the mind. Only about 15% of people think that diet is important when it comes to oral health. Snacking is a huge problem. We've turned from a nation of 3 square meals a day into 8 to 10 snack attacks. And people are constantly grazing on foods which very often are unhealthy. So there's a lot of work to be done around there. I mentioned sugar tax, but also in the government field, labelling. Food labelling, clear food labelling that people can see. I have friends with allergies. Try reading the ingredients when you're going around a supermarket without a magnifying glass to find out where those are. Yes, the main allergens might be in bold and might stand out, but if you've got a minor allergen, you can't find them. You can't find the sugar content, so you can't make those informed decisions. And again, that's something that the Foundation is lobbying on. Our activities spread not only through the UK, but internationally. this year. I've just seen George walk in, the immediate past president of the Platform Better Oral Health in Europe, and we also have Vanessa here from Align, one of our sponsors on the platform. We do fantastic work there. It's a very important time for oral health when we look at the initiatives from the World Health Organization around oral health. This is a once-in-a-lifetime opportunity. These things don't come round other than every 20, 30 years if we're lucky. We need to take advantage of that. We need to be promoting oral health. We need to be supporting the WHO objectives in their oral health strategy and helping to move those forward. And across Europe, and whilst the platform itself is based in Brussels and was originally focused on the EU countries, it really does operate across WHO Europe as a whole, which rather than the 26 European countries, does include the UK and also an awful lot of other countries in other parts of Europe that are part of the EU. So we're talking about really promoting better oral health in Europe across that. I encourage you also to have a look at the new platform Better Oral Health in Europe website, where their manifesto is clearly displayed. So I think you've probably heard enough from me. So really, what we're aiming to do with this campaign, we need to shift the dial. We need to shift the dial in terms of awareness around diet, around the relation to oral health. We need to be influencing these initiatives. We have a government that's keen to raise extra taxes. Let's get them working on increasing the soft drinks levy to a broader area. Let's use the media. Let's build on things like the Panorama programme that highlight so vividly. I still remember from probably the best part of a decade ago now, Jamie Oliver's Sugar Rush programme and his passion around school food. And we really need to build on that to carry those initiatives forward. On labelling, we're fighting for front-of-pack labelling that makes sugar content really visible and understandable. The thing that we get on food labels is no added sugar. People think that's healthy. Might be on something that's absolutely full of sugar, but it's not added. So we need to educate the public. So, what are we going to be doing during the campaign? We're going to be collaborating across the board and across the piece. Now, Smart Month, as I say, has been going for 49 years. We couldn't do this without our sponsors, and we're grateful to our campaign partners, Oral-B, Listerine, Wrigley Oral Health Programme, and Sensodyne Pronamel. And you're going to be hearing from a couple of those later. Their support allows us to take these vital messages out across the UK and support the campaign and get the coverage that we do. And if you look at our evaluation at the end of the campaign of how many people we've reached, National Smart Month has a huge reach. It reaches millions and millions and millions of people. And not only in the UK, because obviously social media is seen on an international basis. And we now have well over 100,000 followers on various social media. So I suppose you could say we're a social media influencer. I've never seen myself. I think I have to do something else. It's probably rather than the leg, I have to have the boob job and the hair. So encourage you all to get involved. The campaign is most powerful with everybody's participation. And let's make, as we look forward to the 50th year, let's make this 49th year our best ever. So, golden anniversary coming up next year is a chance to create real lasting impact. Let's work towards that impact throughout the coming year. So we're obviously, as always, actively looking for funding and partnership opportunities to help make that happen. We really want to make the 50th anniversary a big thing. So do speak to us if you've got an interest in that direction. Now I'm now going to hand over to Natalie Tilbury. I look forward to hearing.
Afternoon, everyone. So we're here from the Kent community, and I am here with my colleagues today. I'm Joanne Dan, sorry, I'm the Advanced Oral Health Practitioner for the team, and I've got my colleague Rebecca Rowshan, who's our oral health educator, down in front here with me, and Natalie, who's our project support administrator. What did you say now? Oh, I can see it.
I can see it. Hey, there we go. Thank you. I can hear myself a bit better now, so thank you. So just want to say firstly, thank you so much for inviting us. We always enjoy coming along to these events, and I think, as you said, Nigel, it's important that sort of, we all collaborate together, and we thoroughly enjoy going out in our community, promoting good oral health to all. We are a very small team of three, but we've got two, myself and Becky, sort of like the oral health educators, and Natalie's our administrator. There's the two of us that cover 12 districts in Kent, so we have quite a wide area that we cover, so always a lot of work to do. So as we know, the theme this year is Feed Your Smile, and in Kent we've been working on that powerful connection between our diet and oral health. As Nigel mentioned earlier on, it's looking at sort of, the general overall health as well is very important, and our diets play a massive part in that, in keeping our nice, healthy, beautiful smiles. And we've been working across our districts to encourage smart choices and promote good oral health. One of our projects we've been working on quite a bit over the last 2 years is appointing oral health champions within the settings that we reach out to. At the moment, I think we actually have 401 oral health champions in Kent, and that's within our nurseries and preschools, the family hubs, schools, being primary schools, secondary schools, care homes, and we've just recently managed to reach out to a few sort of social prescribers and sort of contacting GP settings as well. And as much as we like to try and get out as much as we can, we love face-to-face training. It's not always possible, and these days as well, with the power of everything being virtual and being able to deliver training online, we do deliver a lot of our training to the staff in these settings via webinars. We also provide them with newsletters, and we tend to sort of try and switch the theme up a bit as well, keeping them interested, tailoring the webinars to the individual's needs. For example, so when we do webinars for schools and school staff, our first webinars that we started doing was sort of about the general oral health message, and then over the years we have sort of changed things up slightly, sort of introducing things about what they can do in their lesson plans, trying to help the teaching staff sort of introduce more of those important oral health messages into their lesson planning, advice on trauma, what to do if a child fell over in the playground, what to do about that kind of thing, and safeguarding as well, because I know schools, they're looking out for children's safeguarding all the time, just sort of looking at it, sort of, making sure that they're aware of the oral health aspect of that as well, and to not, quite often we get teachers say to us they're concerned about the children's teeth and the state of their teeth, so just sort of emphasising the safeguarding concerns there if there are other things that they mainly have been doing with the oral health champions. This year we decided as well that we would try and reach out to our Kent libraries and schools to focus on for National Smile Month. It started off with a narrated PowerPoint presentation we did that we were going to send out to all of the Kent libraries, but then after we'd sort of completed the PowerPoint, I thought, well, actually we could send this to all of the schools as well, so just tweaked it slightly so it's for the schools and the libraries. I met with Lindsay, who's a lovely lady who's the Surface Development Manager for Kent County Council, and we had meetings with her, and then once we created the PowerPoint, we sent it to Lindsay, so then she sent it out to the rest of her teams. There are 99 libraries in total in Kent, I think they've got about 5 mobile units. She was telling me that last year they had 3.2 million visits to the libraries and around 6 million issues of books, and you know, they had borrowing of the books of e-books and newspapers as well. So we're hoping that we are going to sort of target quite a wide audience getting into the Kent libraries as well. So some of the pictures you're going to see in a moment are of some of the pictures that have started to come in already. We only sent this out to Lindsay last week. So she sent it out to the library, and already we're getting a few pictures come through. I like that one up there, the Deep Sea Dentist. I think that's, I want to read it. I think I might go just to see what that's all about, the Deep Sea Dentist. So we've shared information with the libraries where they can get information and resources. Obviously we've pointed them to the Oral Health Foundation website where the campaign, all the resources are on there for them, but also information on campaigns like the Better Start for Life, the Top Tips for Teeth, and Twinkle for primary resources. Any of you that have had children might be aware of Twinkle. It's the platform that a lot of the teaching staff use in schools. My son's quite often come home with Bitsby School for a little twinkle symbol in the top corner. So I had a good browse through their page. I thought it was a good opportunity to look at all the oral health resources that were on the web page for Twinkle. And there was a couple to sort of say, you know, can I give, you know, my advice? And I'd have to sort of support them, and they, you know, got back to me and said that they're going to get the graphics team to get in touch as well and just change some of those, because I think it's important that we're putting these messages out there, P-size and MAMS, and then if they're going to be doing these lovely activities in classrooms and in schools, it needs, you know, we need to all be singing from the same hymn sheet. Some more pictures here of some of the pictures that started coming back to us so far. The top one being one of our local family hubs. You can see that they've got the Oral Health Foundation poster right there in the middle, but lots of bits there with the top tips for teeth, toothbrushing charts. At the bottom is a toothbrushing chart that we sent out with our resources as well. So I think that's one particular library has printed them all off for the children to take away from the library and take home, just to try and encourage that brushing twice a day. The picture on the far side, this is one of my local libraries, and I popped in there, and this was in the adult section, because a lot of the pictures and things we've received so far have been mainly focused on children. So it was nice to see that they kind of, you know, done it in the adult section as well. I was kind of hoping that with the theme of Feed Your Smile and healthy eating, they might, there's probably plenty of diet books and all sorts of, let's say, cookery books and all sorts in the library. And I was a bit disappointed when I first saw it, so I thought they haven't kind of got the gist there, have they? But actually looking at it, it made me smile. So they obviously look like they're all books for sort of comedians and things like that. So I thought, well, you know, if we're encouraging people to laugh and smile throughout National Smile Month, that's a good thing too, surely, isn't it? So it wasn't quite the healthy eating display I was hoping in the adult area, but that made me smile too. So they've made the effort. And more pictures again from the library here, and they've sort of got activities there for the children at the bottom with the colouring in. The top picture, because we shared a poster guiding people to our website in Kent Community. So the picture that's got the QR code at the top, people can scan that and it'll come to us at Kent Community, so they've got all the resources that are on our webpage as well, but there'll also be information about how to sort of maybe contact an NHS dentist, out of our services, so information there and sort of trying to seek a dentist and dental appointments as well if they need it. So they've really been making the effort and getting involved. We gave them activities as well, the colouring sheets and word searches. In the previous picture, there's sort of like the colouring in that they've put out for children as well. So hopefully we're going to be encouraging lots of dental and oral health activities throughout the whole month. Just some pictures there of some of the more of the resources that we sent out. You can see the certificate there for the Clean Teeth Club, which is on the Oral Health Foundation website. So we're just sort of collecting all those resources for them and pointing them all in the right direction. Seeing as during National Smile Month, one of the last weeks in May, I think, is half term, a lot of the libraries do a lot of activities for children during half term as well. So I know I've taken my son along before when he was younger. And Lindsay told me that they do have quite a lot of volunteers within the library as well. So we suggested maybe you could do story times, get some of the volunteers involved, and sort of maybe have them throughout half term week. Some story time sessions. So again, like I said, that falls towards the end of May, so I'm hoping we will get more information back on what they have done during half-term week as well. So we'll keep you posted with any information we get back from the libraries and the schools. So within Kent as well, we are big believers of working together, collaborating with other teams and just sort of making every contact count. I'm very passionate about that. I just feel that as health professionals, you know, if you get that opportunity, we go out to a lot of outreach events and you might get asked questions, you don't know how to help someone, but I think being in the positions that we are, we can find out how to help them and guide people in the right direction. A lot of the time we do collaborate with a lot of our other teams within KCHFT. I've been there a few years now and we've got some really good connections with our whole school health team. We work with them quite regularly. The healthy weight management teams, the vaccinating teams. There's so many teams within the trust that we're all collaborating with, and quite often we work together. Back in Mouth Cancer Action Month, we were going out with KCHFT's One U teams, their smoke-free advisors, and I just feel that it's a really good, any opportunity we can to get to work together. We're bigger when there's more of us together. We've also been supervised toothbrushing for the last 2 years in Kent as well. We ran our pilot programme in 2023. It was mainly in some of our most deprived districts in Kent. We supported 12 schools and nurseries to start with, and we were brushing with sort of 3 to 5 year olds on a daily basis. We created our our toolkit and sort of recommended best practice for the schools, concentrated on the cross-infection messages. It was really important to get that across to the school. In the picture here you can see it's one of our schools, they use the plastic plates to put their little pea-sized amount of toothpaste on, so making sure that they're not going from brush to brush with the toothpaste tube. We created social stories for those that needed a bit more guidance and support in the classroom, training sessions for the staff, and most importantly we delivered parent engagement sessions, because you have to gain consent for children to be able to join in on the programme. The parent engagement sessions were a bit slow to start with. It was a bit disappointing because we were getting the engaged parents turning up to the parent engagement sessions. So it's, then we were thinking, well, how do we get these parents that aren't signing up to the programme? So we created a QR code, got the teachers to put it up, by the door of the classroom. So those parents that are in a rush, we could say, just quickly scan the QR code, you can fill out the forms when you get home, just being present on the school playgrounds, just trying to get as much engagement as we can, and as many children to sign up to the supervised toothbrushing as possible. So it was really good when we ran our pilot programme. It was a huge success. We got feedback from parents and from the teaching staff as well, because they're the ones that have to do it. We did face quite a bit of resistance from some teachers to start with, but I think once they could see how important it was for the children and the improvements they were making, I think that did make a big difference. We got a lot of parents as well talking about how their children are more keen to brush at home, the fact that it helped with other siblings as well. So it really did have quite a good impact. I think one of my favourite bits of feedback we had from teachers so far was just a Christmas gone this year. One of our schools had a visit from Father Christmas, and he was talking to all the children in the classroom, and he said to them, what do you do before you go to bed, children? Expecting them to respond with putting out his glass of milk and his little cookie, and apparently the majority of the children all turned around and shouted, brush our teeth. So that's winning, when they, so we're getting there, so small steps. So just some more pictures here of some of our outreach activities that we do. But we, as I say, we love going out into the community. It's mainly our family hubs that we go to, their fairs that they have during the school holidays for the children. We also go to the care conference as well. But yeah, we just love getting out and sharing the message of good oral health. I've put QR code there for our webpage if anybody would like to get in touch with us. So that's the QR code there on the screens. But if anybody would like to reach out to the team in Kent, we're always happy to hear from anybody, always happy to work with anybody. So I'll leave that up there for a moment so I can see a few people are scanning. But that is it from me. So thank you very much. That's my email address there on the screen as well if anybody does need it. So it's all from me. I do apologise. I am going to have to run out the door as well because I double booked in my diary today because Friday is usually my non-working day and I'm taking my mother-in-law out to Andre Roux tonight and I completely forgot I've got to get back to Kent to get her and then bring her back to London. So, but it's been, it's been lovely to come to the event as always. So thank you for having me. I'm happy to hear from anybody. Thank you.
Thank you so much, John. I hope you enjoyed Andrew. You've got to after all that effort. 2 journeys into London.
Thank you very much. Have a nice afternoon.
I think as always, it's great to be grounded and to hear of all that variety of activity that's going on the ground and the different audiences that we can reach in different ways through different means. I think that's always been one of the strengths of the foundation, that we have communicated well in a lot of those areas. I'm going to hand over now to Rhiannon. Many of you will know Rhiannon as president, isn't it? I couldn't remember whether you were president or chair. President of the British Society of Dental Hygiene and Therapy, but she's talking today on behalf of Listerine, so hand over to Rhiannon.
Thank you, Nigel. I always have a moment when I stand up here wondering why people want to listen to me, but I will never give up on the passion I have for any opportunity to talk about oral health, prevention and how we can do the best for our patients. And interestingly, after what you were saying, Nigel, if you're thinking 49, that's a long time. This is 49, so I was also in my 49th year and have never lost the passion. Just in the way National Smile Week has moved to National Smile Month, it will never lose its energy and enthusiasm. And in fact, it gains momentum, and that's what I'm doing. My brief today was to really think, because I don't have very long, I really wanted to be impactful, was thinking about those patients for whom we are struggling a little bit, and whether we're really ever happy to give up or stop trying on those patients. So that's really where we're going with this one today. Perhaps thinking a little bit more about the patients who perhaps we're thinking might be more suitable in palliative care. Are we ready for that? Are we happy with that? So just to be transparent, this presentation has been initiated, organised and funded by Kennedy Limited, who've already reviewed my slides and the agenda and paid me for my time. The views are mine, though, and don't represent the views of any other organisation. So if we think about engaging what we now call the non-engaging patient, well, who decides that they're non-engaging for a start? This has to be a two-way conversation with the patient, and probably more questions from us to them than the other way around, to begin with, so starting with some very basic questions. But it was refreshing when the EFP and then the BSP gave us these newer guidelines that we can define a non-engaging patient. We really weren't able to do that before. I guess all we had were indices that we could use. Maybe if you're into motivational interviewing, we could use some scaling. So we could ask a patient on a scale of 1 to 10, how interested are you in this? But it really was quite difficult. Really, we still do that, but we now have a term that we can use. But what do we do with it? And I think my question to you is, how can we get a better outcome for our patients? When would you ever be happy to give up on these patients? And also a reminder of the point at which we want to intervene with these patients. So perhaps when I was an undergraduate, we did BPEs back then, and we focused much more on a BP score of 3 and 4. They were the patients, as an undergraduate, I wanted to treat because I knew I would be doing more treatment and gaining more skills with it. Less focus was on actually the BPE score of 1, which is actually probably the most important BPE score, because that is our opportunity to prevent disease, not wait until it's progressed. So are you ever happy with palliative care? Because I'm not. So you can read this, but I wanted to highlight today the role of any adjunct. So before we wave the white flag on the patient that we've considered to be non-engaging, we're not seeing a big reduction in plaque scores, we're still seeing gingival bleeding, we're having some issues, maybe mucous lesions as well. When we're designing that care plan, have we done everything we possibly can? Because there is evidence now. So even after instruction and support, we really focus on biofilm removal, we can see from the data that it's insufficient in many people, and that we know that the risks that poses. So taking into account all of those limitations, whether it be a physical limitation that they actually can't hold a toothbrush in an effective way, whether it's a cognitive issue for the patient, we have to accept that it's effective biofilm removal that's going to make the biggest difference, and that there are some adjuncts that we could use to help our patients. So I'm talking again now about periodontal disease and the S3 level guidance on the use of chemotherapeutic agents as an adjunct. So I don't expect you to read what's encircled there, but it says about efficacious use of toothpaste and mouthwashes, and that's reiterated on these two banners here as well. So there is evidence, and the patient deserves to know that there is evidence. So I challenge you in the audience now to think about your preconceived ideas of toothpastes and mouthwashes. And what does a patient have in their bathroom that they look at and they think they need? So they'll know they'll need a toothbrush, they'll know they'll need a toothpaste. Do they realise they also have to have something that cleans in between the teeth? Do they know that there are different types of ingredients in toothpaste? And do they consider mouthwashes to be effective? Or do they just think it's a nice thing that they can freshen their breath with as well? So I'm challenging you to think about what your patients think. Also, what are your preconceived ideas about the use of adjuncts? Because it's very different now to how it was when I was an undergraduate, and I was also an educator as well, and at the beginning of that career, I said different things about adjunctive care to what I would say now, and thank goodness we have the evidence as well. And just a note, because I'm a dental therapist by daily practice, it's not just about periodontal care either. And I'm very pleased to say that a very clever team are working on the same S3 level guidance for caries prevention as well. I think most of us have got quite used to and comfortable with the S3 level guidance that we have for periodontal treatment, and I really look forward to having that support and being able to talk about that and teach that with regards to caries prevention as well. So, you'll now want to know which ones actually have the evidence that back up their use. So, the ones with essential oils, the ones with chlorhexidine, and the ones with cetylpyridinium chloride. And actually, according to the S3 level guidance, among the different antiseptics that have been tested, these are the ones with the most efficacious, and they are in certain concentrations as well. There is a reference slide if anybody wants it afterwards. So I'm going to focus just very quickly on the two main guidelines that came out of the S3 report through EFP and NBSP. So 4.10, the basis of the management of gingival inflammation is self-performed mechanical removal of biofilm. No one's going to argue with that. But it says adjunctive measures, including antiseptic, may be considered in specific cases. You, as a clinician, and the conversations you have with the patient, and what you've been asking, and what you've gleaned from that patient, that's when you make a decision. I would say, how would you justify writing in someone's clinical notes that you're putting them into palliative care? You're not going to move them onto step 2 care, even though they have some pockets and they have bleeding, because you have made a decision that it's not moving anywhere. In order to justify that decision, you would have to be able to say you've tried everything. And this guidance exists now. So if anything were to ever go wrong in the care of that patient, someone could easily say, did you ever try that? Where is it in your notes that you talked about the use of effective toothpaste and effective mouthwashes as well? So it's being aware that the people who look at what we do and actually maybe judge us on what we do, they can see these guidelines as well. The patients deserve to know that they exist. And then 4.13 is if an antiseptic mouthwash is going to be adjunctively used, we suggest the 3 products I've already talked about. So these exist for you to The best delivery format is interesting as well, because this is possibly something that challenges our preconceived ideas and maybe what we were taught at undergraduate level and maybe in our earlier careers. But mouth rinse delivery formats offer better distribution in the mouth and also sometimes better pharmacokinetic properties. And mouth rinses have been proven to achieve greater reductions in dental biofilm levels as well when compared to some toothpaste. Whereas there's limited evidence still to support which vehicle is better with regards to gingival inflammation or whether it's a newer vehicle on that. And in addition, it's also evident that the ideal delivery format will depend on the active agent to be delivered. So, for example, and you can see it here for chlorhexidine, CPC and essential oils, that would be in a mouth rinse, with copolymers and stannous fluoride, for example, would be better in a toothpaste. So it's working out for each individual patient what their risk factors are, what their abilities are, as to which would be the better delivery system, and it should be both, if we're saying that we want to do everything we can. So what do we need to remember? Well, we need to know what options exist. We talked about the three, but there are other things that we need to consider. Some people will want alcohol-free. Some people don't like a very strong taste, so we need to make sure that we have in our armament, in our head, we need to know which ones we can recommend when someone says, I don't like mint, or I'd like it to be alcohol-free. The fluoride content in there is quite important as well, obviously, especially when we're talking about caries reduction. And acceptable flavours. I mean, my patients will even say, do they make it in blue? Because that's what I want for my bathroom. You know, people are not thinking the way we're thinking about reduction of inflammation and biofilm control. They're thinking of which one matches my bathroom. And also the other one is ease of opening the bottle. I can't open the bottle with some mouthwashes. I've got to stick them in the door jamb, go and get a rubber band. It's the things that we perhaps don't think about, that when we've spent time with that patient, we can see they're not going to be able to manage certain things. And then there are some considerations to just be aware of briefly. So we know, and I put the paper here, about the worry years ago about alcoholics using alcohol-containing mouthwashes, but it's just a very quick word to say that was to do with ingestion. It wasn't using it as a mouth rinse and spitting it out. So that was where that concern came from. But I remember being told that many years ago, and I still work with people that bring it up as well, so just to be clear on that one. There were no studies done on pregnancy and breastfeeding, so that's something you'd have to consider, and they could always ask their OB/GYN anyway. Staining is a minor risk, but it's worth mentioning to the patient and giving them some advice on how we can reduce that. And also, when we have the stronger tasting ones, and you'll know the more medicated ones sometimes can change the person's taste as well. And just to warn them that some of them do have an intense flavour, and that might alter their taste sensation. So when we're prescribing them, we just have to think a little bit about it. And with there being increasing allergies as well, it's probably worth saying to a patient, if you have any reaction to this, local reaction, and just stop using it straight away. Okay, in summary then, the use of specific antibiotics as adjuncts is effective in reducing gingival inflammation and controlling biofilm, and there is now evidence to back this up, evidence that we could be judged against. So before you move your patient into preventive care, have you actually given them all the information they need? Have you given them all the choices, all the options that exist before we move them into that? Antiseptics are generally safe, although there are some side effects which I just covered. So, children under 7, anyone who might swallow it, you just have to be a little bit more mindful. But the general population can and will benefit from the adjunctive use of antiseptics. However, you want to identify the subjects who will benefit the most, because it says you may want to consider it, not that you should be considering it. But I'm happy to take any questions of anybody now, but I'm also happy to move on to my next speaker, if that's okay. Thank you very much.
Rhiannon, thank you so much. Any burning points to just...
I'm not rushing as I am here, and I want to be on the Sky Garden with you all later as well. Thank you.
Rhiannon, thanks so much for that. And rounding off the afternoon, our final speaker from Haleon, representing Sensodyne Pro-Enamel, Dr. Kate Fabricant.
Thank you so much. I have hard acts to follow, I must admit, but I'll give it a go. So I'm representing Haleon, and that's a leading healthcare company, global healthcare company, which is whose purpose is to deliver better oral health for humanity. Here, specifically, I'm representing the oral care part of this company and the expertise which we have in the specialized brands which we have, and one of them being Sensodyne. But the things which I wanted to talk about today, firstly, the fit with Feed Your Smile. I mean, Sensodyne Paranano for us, when we were discussing it, was the perfect fit because of how it communicates on the importance of particular dietary choices, and all the activation for the next month will be around the campaign and the choices which individuals have to make. But more importantly, I wanted to talk a bit more about the journey into prevention and how we can potentially help as industry in this journey today versus 49 years ago and 70 years ago, whereas then it was quite an obvious, okay, let's launch fluoride-containing toothpaste and make people healthier through it. Today it's trickier because today it's more about how do we unlock the understanding of what's going on in the consumer's heads, in the individual heads, and how we help them and empower them to be better in their everyday habits, in their oral hygiene habits, in their dietary habits, and actually give them the depth of understanding in what their choices do to their health over time, because it isn't that straightforward. It's not like with cutting yourself. You cut yourself, you have pain immediately, and you know that you've done something wrong. But if you're not brushing your teeth, or you're not using fluoride toothpaste, or you're not eating, you're actually eating quite a lot of sugar-containing foods, you will not see the results of it immediately. I will take you on a bit of a journey which took us about a couple of years, I would say. We've realized that to unlock this depth, we need to talk to consumers and dental professionals in the UK a bit more and reconfirm what the barriers are. Because in the UK we know that there is still quite a strong, and Nigel talked about it, there is quite a big group of people who are still not healthy, who are growing up not healthy, and we genuinely wanted to look into how we can facilitate these people to become better off, more empowered. This journey started with us partnering with College of General Dentistry and figuring out, okay, how can we survey what do we need to ask the consumers and what do we need to ask dental professionals to understand better the barriers which they have to face day in, day out. Initially, we ran a qualitative surveys with both groups, and those came up with quite a list of barriers and challenges. Some of them were very specific to the stakeholders in the government, potentially to address. Some of them were probably more linked to dental profession, and some of them were quite specific to what we call consumers, so to the individuals. We then went off together with the, actually we didn't, as Kane, go off anywhere. We asked College of General Dentistry to set up focus groups and talk with dentists behind the closed doors to understand where their frustrations are and what they would want to change and how they believe things can be changed. That led to them issuing a report which is now available on the college webpage, which set out quite a few recommendations for the government, for the profession, and for us in the industry to address. The governmental ones were quite connected to some of the things which are now all over the press, which are presented through the Department of Health initiatives, through the NHS 10-year plans. And just to give you an example of one of the recommendations which came out, please make delivering better oral health toolkit more user-friendly and potentially accessible for the consumers. There were quite a few recommendations around the contract. It wouldn't be a surprise to anybody here that those exist. What we decided to do in consultation with the college was to actually set up a conversation which happened in December last year in the Parliament, and set up a table at which different representatives of the government, of the profession, and charitable organizations could have an open discussion around the issues and what they would prefer how they would prefer those to be addressed. And I must call out Oral Health Foundation as one of the active participants in this roundtable and this conversation. Ourselves at Haleon, we did provide our input into the consultation on the NHS 10 years plan and the importance of oral health to be included in the 3 sheets, and we'll continue to work around this. When it comes to the specific recommendations and things which have to be done with the dental profession, we in Haleon, through our brands, through Sensodyne, Corsedil and Aquafresh, as well as Above brand, support and through our profession experts, we call them expert activities, support quite a lot of educational activities. We celebrate the profession as well, and we do work through the allied professions, which are not dental necessarily, to raise the awareness of oral health. Quite a lot of this is done through the Haleon Health Partner websites, as well as through other means. There are quite a few programs which you probably might have seen, might not have seen, like collaborations which we support between the FDI and International Federation of Pharmacists, which again promotes the awareness of oral health and makes allied professions more capable of having those conversations around what's important, how to make it better, and so on. But last, not least, is what we as the dental industry believe we have to do, or are doing already, to actually make individuals, consumers more aware, more knowledgeable in attaining their oral health. Those things are linked to some of the findings of the survey as well. We realize that there is this disconnect between what people think they have to do and what they actually have to do. And there is also frustration in the profession that there is quite a lot of misinformation available in social media, in other media outlets, through the non-certified digital influencers. So I would call it this way, in a very polite manner. And that's why we partner with oral health foundations and other entities to ensure that the consumers get trusted information available to them. We also, as a company, are committed to making sure that all of the information which we put out, be it through our advertising, PR campaigns, etc., is based on evidence, is based on trusted science, is based on the Delivering Better Oral Health Toolkit. Love it or not, we're trying to make sure that we simplify those messages bite-sized and make them meaningful to the consumers, because we actually understand what drives the behavioral change within the consumer group, and we're trying to anchor into this. There are other, all of the stuff which I was talking about so far is very much things which industry, profession, and the governments have been doing to larger extent or lesser extent over the years. But what we also try to do as a company, we're trying to reinvent things. And I'm quite excited about a couple of programs which we started late last year and fielded beginning of this year and will continue to field over the coming month, which are slightly different. So we're trying to establish a partnership between one of the biggest retailers in the country, which is Tesco's, and ourselves to promote health, to educate consumers on what health is, and how you can attain it better. This is done through Tesco Health Zones initiative, and we were selected by them as the provider for Oral Health Hub. It is a pilot at the moment. We will be reporting on the outcomes probably in the second half of 2025, but it's one of those initiatives where Tesco shoppers are able to access free advice on how to best take care of their teeth and mouth from qualified oral health educators. And I'm looking at Rhiannon because we had a bit of conversation on that, but we actually did select quite a few marvelous, excellent, I would say, not marvelous, excellent dental hygienists to partner with us in this program, because we wanted to make sure that the messages are correct and the advice which is provided is appropriate. We provided the group with a couple of materials which were based mainly from NHS recommendations. We also qualified it with the professor, just to make sure that we are doing things correctly. I always think, I probably know more than I should about oral health, dentistry and other things, but then at the point of print, I've really started becoming jittery, so I always triple check things. The same partnership also includes us supporting a charitable program which is called In Kind, and that program covers quite a proportion of people who are in hygiene poverty crisis and have to choose between eating or hygiene versus heating. And for those, we are supporting, this program we are supporting the product, which is distributed through the charity to the people in most need. There is the last piece of this puzzle, which hopefully will be announced quite soon, and it's early years educational program, which will be spearheaded by Aquafresh, and will provide educational materials to look after teeth and gums to school in the most deprived areas in the UK. That program is very close to my heart, and I'll most probably say that this one is the most connected to the theme of this event as well, because there will be a lot of really good messaging there on the diet and hygiene and what should be done and how it should be done. I will probably hijack the next year's meeting as well, because I genuinely hope that there will be a lot to report on that one. But with this, I'll stop talking and take questions, or stop standing between whatever the drinks are and the further events of the day. Thank you.
Okay, thank you so much for that. I think it's very interesting to look at the range of what we've heard this afternoon, from activity on the ground in communities, how oral health reaches out and is delivered through areas like libraries, as we heard from Kent, through to what to me, it's a fascinating word, but I've never thought of what we do with our basic periodontal therapy as palliative care, but of course it is. I think that's really thought-provoking and something I will take away, so thank you. Then through to the way that responsible corporate responsibility from companies can lead into action, leading to health change, and really exciting to hear of the work with Tesco there for Kate. That brings to the end, you'll be glad to hear, you're going going to be released back to the buffet and drinks. Now we're here until 3:30, so do mingle, enjoy yourselves, take the opportunity to go up to the 5th floor, to the balcony, and have your photo opportunity against the Houses of Parliament. And thanks once again for your support, for you all coming to this event. It's really important to us, and it's great to see you all here from such a diverse background, and look forward to hearing the results of your Smart Month activities as they come in.